Hello, welcome to Walk, Don't Run to the Doctor with Miles Hassell, MD. This is an evidence-based podcast for people who want to use lifestyle choices to avoid preventable illness, as well as to treat illness. Listeners will learn the choices that work for better health outcomes for themselves, the ones that they love, and the patients they care for. We want to see patients liberated from the burden of chronic disease whenever possible. Hello, I'm Miles Hassell, MD, and you're listening to Walk, Don't Run to the Doctor. This is episode 18, and we're going to be talking about how your exercise habits can affect your success of cancer therapy, outcomes from cancer therapy, and whether or not you get cancer in the first place. So this should apply to just about everybody, but we're going to be focusing a little bit more on the patient with cancer, especially the patient going through cancer therapy. And I think many people will be surprised at what a great impact exercise does have on the cancer therapy and the cancer outcomes. But let's step back for just a minute and think about how the cancer diagnosis is your signal to take control, if you aren't in control already. That involves choosing to collaborate with an excellent cancer treatment team. And that can include your oncologist and your surgical specialists and your radiation oncologists and others. And identifying which doctors or other therapists really own your case, and making sure that the people are really taking responsibility and that you're taking responsibility. Part of that, of course, is also to find a loved one who can join you for appointments, be your support person, an additional brain, somebody who can cut through some of the fog that can occur with having a serious illness. And throughout it all, don't be afraid to ask questions. Remember, your medical team are your servants, and they should give you the information you need to make good decisions. So don't be afraid to be a little bit annoying. I remember one of my mentors, we were walking out of a hospital room after seeing a patient, and the family were just peppering us with questions. Peppering us. It was really annoying, but they were all good questions. And we walked out, and he turned to me, the older guy turned to me and said, "You know, Miles, that family is just driving me crazy. And if I'm ever sick, I want a family just like that, looking after me. This is your life." So, taking control has a bunch of useful side effects as well that often people don't think about. One is it reduces that confusion. It increases clarity of decision making. It improves confidence and reduces anxiety. So be in there and swinging during any healthcare crisis. During that time also, maintain reasonable expectations. That's part of asking questions. Sort of know what to expect, what not to expect. And means reading material. If a doctor gives you material about a drug you're expected to take, read the side effect list. Think about it. Look at the benefits. Look at the risks. And your attitude carries over into other areas. And this is another subtle area of being an effective patient. Because the more attitude you have, the more control you take, up to a point, will improve the quality of care you get from your medical team. When your medical team sees you working harder to improve your outcomes in subtle ways, I will think that you will find that they will work harder for you. That's sort of an interesting aspect of human behavior, of encouraging those that are encouraging you, of encouraging those that are trying to support you, encouraging those who know more than you do about the disease process, and making sure you keep the team well-oiled in your care. And that means also being nice to your team. So when we think about exercise and cancer, let's think briefly about how exercise helps prevent cancer. And so this is a large study with about 405,000 people studied in an observational manner. And they looked at how much exercise these people got over the period of time, and they looked at many, many outcomes. But one of them was the risk of cancer. And they found that those patients who had about 150 minutes a week of moderate exercise, or about 75 minutes a week of vigorous exercise, had anywhere from 40 to 50% less risk of getting cancer to start with, and anywhere from about 15 to 40% less risk of dying of cancer. Plus, of course, when you exercise, you're at lower risk of just about every other chronic disease: heart disease, stroke, depression, joint disease, type 2 diabetes. It goes on and on. And so for everybody who's watching or listening to this, remember to start a exercise program if you're not already doing something, and do it every day. So now we're looking at the patient with cancer, and we're saying, take control. And you're saying, what control do I have? And we already talked about your relationship with your medical team, but you also have a relationship with food, with physical activity, with waste management, meaning how big a tummy you have. And then there's other tools: heat, sunlight, sometimes nutritional supplements, attitude, purpose. These are all factors that impact your outcome from your cancer therapy. But today we're just going to be talking about physical activity or exercise. So you're a patient who's had cancer or is undergoing treatment for cancer, and you're saying, what will physical activity do for me? Well, in multiple studies, it'll reduce your risk of dying of any cause by 30 or 40%. In some studies at higher levels of activity show risk reductions for dying of any cause as high as 70%. And these studies are anywhere from 2 to 5 years in duration. It reduces the risk of dying of your cancer, and somewhere around a 40% reduced risk of cancer recurrence. Now, these numbers may sort of not mean a whole lot to you, but bear in mind that these compare very favorably with the kind of results that we expect to see from chemotherapy and radiation, for example. These are not to be sneezed at. Consider exercise as part of your essential cancer treatment. When we look at the exercises that are studied, typically they're things like a treadmill, walking on a treadmill, riding on a stationary bike. Sometimes they're resistance exercises. But don't get too fussed about things like that. Look at things that you can do. And remember that the greatest degree of improvement, the lowest risk of dying of any cause, is associated with levels of exercise that start at somewhere around what exercise physiologists call 10 to 15 med hours per week, which is, maybe call it walking briskly for 3 hours a week for most people, something like that. But it doesn't have to be walking. We'll find something that will work for anybody for exercise. The other thing to think about here in terms of exercise and cancer therapy is not only does it reduce your risk of dying, reduce your risk of dying of your cancer, reduce your risk of the cancer coming back, but it also seems to include benefits such as better tolerance of cancer therapies, less fatigue, better exercise capacity, of course, improved strength and physical function, improved quality of life, less anxiety and depression, fewer side effects of the cancer therapies, and better tolerance of the therapies. You bounce back more quickly after undergoing cancer therapy, which is another big benefit. And while we're talking about exercise, remember that sitting is bad too. So, and you can be a very fit person and still sit too much. And for the cancer therapy, the more you sit, the more you increase your risk of dying, and the more you increase the risk of dying of your cancer. Plus, the more you sit, you're going to have more fatigue and depression and a poor quality of life. So, if you're somebody who, for whatever reason, sits a lot, make sure you set an alarm and get up about every hour. Maybe you just move around. Maybe you might do a couple of counter push-ups or jumping jacks. Move as if your life and well-being depended on it, because I think it does. So, how about choosing an exercise program for yourself? Well, first of all, you can make it up, because nobody knows exactly what the best prescription for exercise for you is. So, in general, we suggest people start with something that they can do 3 times a day, even if it's only for 1 minute. Somebody who isn't used to exercise, walking down their driveway might be as much as they do to start with. A couple of stairs, maybe lifting some soup cans. But once people start doing something 3 times a day, briefly, and then increase it so as you exercise, you're also a little bit short of breath. Then you know you're getting a decent amount of exercise. Then think about doing something that's upper and lower body. And we use everything from stairs to grip strength trainers to housework to table tennis to medicine balls to gardening to resistance bands to dumbbells. Don't let anybody limit your ideas of what is an appropriate exercise for you. An appropriate exercise is something that makes you short of breath. It makes you short of breath, even if it's only briefly, 3 times a day. In our office, we have these grip trainers all over the place, so that even if we're just talking on the phone or thinking about something, we can get a useful amount of exercise. Plus, once you've used these for a little while, there will be no jar you can't open, and that's got to be a benefit. Skip ropes, really underrated. I'm going to reach over here and grab something like a kettlebell. You can get these in 5 pound, 10 pound, 20 pound, 30 pound, whatever weight you want. You can do all kinds of things with them. How about a medicine ball? Even little things like that make a difference. Waving it around makes a difference. Just get short of breath every time. Maybe you can't think of what you can do. Then go get some advice. Find a fit friend, a family member, a physical therapist, a personal trainer. Somebody can walk you through something that would be safe for you, effective for you, and enjoyable for you. For example, if somebody said, hey, Miles, how about if you go for a run every day? I would say, forget it. If they said, how about if you play tennis or pickleball or ping pong every day? I'm on. So find something you enjoy. Avoid sitting for more than an hour. And if you can't find something vigorous to do for 1 minute, 3 times a day, you've got an attitude problem. So how do you fix an attitude problem? One thing is to find somebody who needs to exercise as well, who needs encouragement, and in turn will encourage you to exercise. Those people are plentiful. Maybe find some related activity that will be a service to others. Does somebody in your neighborhood or club or church need help? There's somebody you know who's ailing or lonely and just needs a phone call. So remember to as much as you can move outside of yourself, outside of your own problems, outside of your own brain, you're going to find it easier to make a lot of good lifestyle changes. You might be wondering, how can exercise do all this stuff? How could it possibly save my life? I mean, isn't it just like muscle? No, it's not. The trouble is, we don't actually understand how exercise works for cancer. But we have a number of mechanisms that we think probably are relevant, and they probably all overlap. It seems to create a negative environment for a tumor, so the tumor is less likely to grow. And this can be anti-inflammatory effects, immune dysfunction effects, maybe antioxidant effects. It has all kinds of influence on your endogenous hormones. And that those, in and of themselves, affect cancer growth and whether or not your body resists the cancer. Insulin and glucose metabolism are really key. And if you hear what we say about the dietary approaches to a cancer survivor, then you know that reducing simple sugars and refined carbohydrates are probably a pretty important step. There's a hormone called IGF-1 that's intrinsic to exercise and cancer therapy. There's all kinds of issues around autonomic dysfunction and how that affects cancers. And then this vague category that we call improved functioning of metabolic pathways. Then, of course, there's the non-cancer related effects of exercise. And when you're thinking about these effects, remember that most patients undergoing cancer treatment don't die of their cancer. Most of them die of things like heart disease, pretty ordinary stuff. So with exercise, we think will help you survive your cancer, bounce back faster after cancer therapy, and then it will also reduce your risk on just about every other chronic disease, heart disease, diabetes, stroke, you name it. So when we look at heart disease in particular, many of our cancer therapies are actually hard on the heart, what we call cardiac toxicity or cardiotoxicity, and exercise tends to reduce that. Whether you're being treated for cancer, are a cancer survivor, or just don't want to give cancer, my message is make daily vigorous activity a daily habit. And even tiny little doses of exercise add up. So don't let yourself not do exercise because you can't do half an hour or an hour. If all you can do is 1 minute, do it. Find some physical activity you can do. Don't find excuses. Find out what you can do. And pretty soon, probably in November of this year, 2024, we will have our complete cancer survivorship and prevention guide for physicians and patients on our website, greatmed.org. And that will have a more comprehensive treatment. But get started today. Thank you for listening. I'm Miles Hassell, MD, that practices internal medicine in Portland, Oregon. The website is greatmed.org. The book is Good Food, Great Medicine. And the podcast is Walk, Don't Run to the Doctor. Thank you.